The United States is a very interesting conundrum when it comes to healthcare. The fact that we spend the most per capita, nearly twice as much compared to other peer nations on healthcare, yet we have worse health outcomes. And there's been a lot of debate as to why this is. A lot of the focus in the media lately has been on pharmaceutical spending. It's also been related to administrative costs. However, as an economist who studies how we pay for healthcare, I think it's important for us to dive into why exactly this is. Now, the Kaiser Family Foundation collected data both from the United States as well as other peer OECD countries and compared healthcare spending between the two. If we look at the general spending levels, as I mentioned before, the United States spends nearly twice as much per capita on healthcare spending compared to other peer nations. And if we break this down by category, some interesting patterns emerge. Now, as we can see, the amount that the United States spends on inpatient and outpatient care, pharmaceutical drugs, as well as administrative spending is higher compared to other peer nations. However, I think it's important for us to measure the distribution of the difference of spending between the United States and these other countries. And what we see is that for inpatient and outpatient care, that spending difference contributes to 80% of the total difference compared to other peer nations. This contrasts with 12% of difference in spending between both prescription drugs as well as administrative spending. And healthcare spending for both inpatient and outpatient care is also growing at a faster rate in the United States compared to other peer nations. In fact, between 2013 and 2021, spending on inpatient and outpatient services increased by 60% in the US. This contrasts with an increase in 40% compared to other peer nations. And what's interesting about this difference in spending is that although spending is higher in the US, there's little evidence to suggest that this is due to a higher utilization of services or due to a higher quality of care. In fact, we know that people in the US are less likely to see a doctor, have a long hospital stay, or be able to make a prompt appointment with a provider. And what's interesting, right, is that a lot of the efforts made to reduce healthcare spending here in the United States specifically focus on prescription drug spending. However, even if we were to reduce our prescription drug spending as well as our administrative fees to what comparable countries spend on those things, we would still have a pretty significant difference in healthcare spending because a lot of the spending is driven by this inpatient and outpatient care. What's a little bit frustrating about this particular study is that the category of inpatient and outpatient care is very broad. In fact, the study classifies inpatient and outpatient care as spending made to hospitals, clinics, and physicians for services, as well as fees for primary care and specialist visits and surgical care. It would be very interesting to see and have a lot more information about how exactly that spending is broken down. However, from other studies, we can speculate about why inpatient and outpatient care is a lot more in the US compared to other countries. A big reason is the fact that in a lot of countries, specifically those that have universal health care, they have implemented strategies to contain costs. So for example, Denmark sets global spending budgets for regions and municipalities. There's also an effort to adapt a value-based model, which pays based on whether or not the patient gets better versus how many services you implement on that patient when delivering care. Right, in the US, there isn't this same concerted national effort to contain costs, although health insurers do this, except their motivation is to increase profit margins, right, by reducing their costs. But there isn't this nationalized effort to reduce or cap healthcare spending. There's also the issue of physicians and physician shortages, which honestly I think needs its own video because I have a lot to say about it and it's a very complex problem. But the reality is that for the US, a lot of the increase in healthcare spending leads to people not being able to access care, which is detrimental to healthcare outcomes across the country. And ultimately, there needs to be a concerted and well-funded effort to address these issues. And unless we do, unfortunately, we're going to see more of the same. Healthcare costs rise with no improvements to overall health in the US. And for now, that's all I got. As always, if you have any questions, let me know.